Hello everyone, welcome again to this class on the parietal bone. We have here the parietal bone as well as the rest of the skull for your view. Let us begin from one point. Let us start at this anterosuperior angle or frontal angle of the parietal bone. This point is also called the bregma because it is the meeting point of the two parietal bones and the frontal bone. It is also the site of the anterior fontanelle in the newborn. Passing along the superior border, we come to the posterior-superior angle or the lambda. This is again a meeting point of the squamous part of the occipital bone as well as the two parietal bones. This superior border forms the sagittal suture with the opposite parietal bone. From the posterior-superior angle to the posterior-inferior angle, this is the posterior border. So we have the frontal angle, occipital angle, and coming down over here we have the mastoid angle. This posterior border of the parietal bone forms the lambdoid suture with the occipital bone. With the two parietal bones together contribute to the lambdoid suture. The lambdoid suture is not this much. There is another part of the lambdoid suture with the opposite parietal bone. Now when you come down to the mastoid angle, this is the meeting point of the parietal bone, the mastoid part of the temporal bone as well as the occipital bone. This point is also called the asterion. Then we pass along the inferior border from the posterior inferior angle to the anterior inferior angle, and here you find the articulation between the squamous part of the temporal bone and the lower border of the parietal bone. And in the anterior inferior angle, this point is again known as the terion, and it is a union of the frontal bone, anterior inferior angle of the parietal bone, the squamous part of the temporal bone, as well as this little bit over here is the greater wing of the sphenoid. So this entire articulation over here is H-shaped. You can see here that the greater wing of the sphenoid has contacted the frontal bone, and this parietal and occipital, the parietal and temporal bones have come in contact, but the greater wing of the sphenoid, it has gone in between, and this junction is actually the terion. Now apart from that, you can see the zygomatic arch over here, and you can make out the zygomatic bone over here. Now let us go to the next picture. This is how you will hold the parietal bone in anatomical position. This is the right parietal bone. It should be held with the right hand, but I have held it with the left hand because with the right hand I am taking the picture. The trick is that the anterior inferior angle or the sphenoidal angle, which is going to form the terion, this should point forward and downward, and the bone should be held vertically with the convex outer surface and the concave inner surface, and the superior sagittal border will be on top and the inferior border over here will be below, and the sagittal border should be held in such a way so that the two parietal bones together will complete the dome of the skull. Let us go to the next picture. Here you can make out the details on the external surface of the parietal bone, and again you have the frontal angle over here, the sphenoidal angle over here, the occipital angle over here, and the mastoid angle over here. So anterior superior angle, anterior inferior angle, posterior superior angle, posterior inferior angle. You have the anterior border over here, the anterior or frontal or coronal border, which will form the coronal suture with the frontal bone. You have the inferior border over here, which is also called the squamous border. It articulates partly with the squamous part of the temporal bone from here to here, and the mastoid part of the temporal bone from here to here. And again you have the posterior border or the occipital border or the lambdoid border, which will form the lambdoid suture extending from the occipital angle to the mastoid angle. And you can make out this small sutural bone or Warmian bone trapped within the lambdoid suture. On the external surface, the most prominent point on the convexity is called the parietal tuberosity or the parietal tuber. Apart from that, you can make out two faint lines over here, of which the lower one is more prominent, the upper one is less prominent. These are the superior and the inferior temporal lines, which are convergent in front and divergent behind. To the inferior temporal line you have the attachment of the temporalis muscle itself, and to the superior temporal line from below you have the fascia covering temporalis. This is attached to the superior temporal line, and from above to the superior temporal line is attached the epicranial aponeurosis. This epicranial aponeurosis belongs to the soft tissues of the scalp, which we will study in a later class. Now let us go to the next picture. This is the inner surface of the parietal bone, and here again you can make out the anterosuperior angle, anteroinferior angle, posterior-superior angle, posterior-inferior angle, superior border forming the sagittal suture, anterior border forming the coronal suture, posterior border forming the lambdoid suture, and inferior border forming the squamosal suture. What you can make out is on the inside of the sagittal border or superior border there is a groove which lodges the superior sagittal sinus, and this groove itself is the sagittal sulcus. To the margin of the sagittal sulcus in this green line you have the attachment of the falx cerebri, which is a dural fold derived from the meningeal layer of the dura mater, and the attached border or the attached margin of the dural fold gives lodgement to the superior sagittal sinus. So this entire border is vascular in nature, and you can make out two foramina over here. These are known as the parietal foramen. They give passage to emissary veins connecting the superior sagittal sinus to the veins of the scalp. So the anterosuperior and posterior superior angles are quite vascular. Now the posterior inferior angle is also quite vascular because you have the groove here for lodgement of the sigmoid sinus. This sigmoid sinus is a continuation of the transverse sinus which has come from the squamous part of the occipital bone, and beyond the parietal bone it is going down into the mastoid part of the temporal bone. If you look at the inferior border you can make out two other prominent vascular grooves, one rising from the anteroinferior angle and one from slightly behind the middle of the inferior border. Now these grooves are also for the lodgement of blood vessels. These lodge the middle meningeal vessels, of which you have middle meningeal artery and middle meningeal venous sinus. The groove on the bone is actually formed by the venous sinus, which is the outer structure, and the artery is the inner structure. The middle meningeal artery, as you recall, is a branch of the first part of the maxillary artery, which itself is again one of the terminal branches of the external carotid artery. So now you can understand that all four corners of the parietal bone on the inner surface are quite vascular. Apart from that, let us look at two other features. The inside of the parietal bone is related to a number of important areas of the brain, and if you draw an imaginary line obliquely passing upward from the anteroinferior angle, this will correspond roughly to the lateral sulcus, and if you draw a line obliquely downward about 3 to 4 centimeters behind the anterior angle, this will roughly correspond to the central sulcus. That means somewhere here is the frontal lobe of the brain, this is the parietal lobe of the brain, and this is the temporal lobe of the brain. That again means that this region is related to the motor cortex, this is related to the sensory cortex, this is related to the auditory cortex. Not only that, the inner surface of the parietal bone is also related to the sensory speech area somewhere here, the vernix area, and the motor speech area somewhere here, the Broca's area. Coming back to the previous slide, this again is the parietal tuberosity, and the parietal bone ossifies in membrane, and two centers appear over the parietal tuberosity close to each other roughly at the 7th week of intrauterine life, and ossification proceeds in a radial manner from the parietal tuberosity towards its margins. I think that's all for today. Thank you.